Hello, everyone, colleagues, comrades. My name is Kristina Baines. I am Associate Professor of Anthropology at Gutman Community College. And I am here today to talk about an op-ed that I wrote that was published in the New York Daily News on April 22nd of this year, 2020, entitled "Health Isn't Just the Absence of Disease, an important coronavirus lesson." So I begin the op-ed by talking about how I am part of the academic technology team at Gutman, one of the area coordinators for academic technology, and in March we began by scrambling to get all of our classes converted to distance learning. We settled into some kind of rhythm. And the emails started coming in. As we all know, there has been an incredible increase in workload via email from students. And many of those emails I responded to, all of those emails I responded to eventually, with the I hope this finds you safe and well. And as I was doing that, I began to think a little bit more about what that meant. So I was hoping that everybody is safe as well, and I do hope everybody is safe and well. That's part of why we're here, the work that we're doing at the union to keep all of us and our students, of course, safe and well. But what I was meaning by that, I got to thinking, was that I hoped everyone was free of the virus, which of course is very important, right? That people had not contracted the virus. And then as the emails started coming in over the weeks and months to follow, I started to think about the student experience of wellness and what that meant for our students to be well. Obviously, it meant for them to be safe from the virus, but then I started to get the emails about students who had lost jobs, families who had lost employment, families who had lost family members, sometimes multiple family members, and students were concerned that they weren't getting their assignments in and told me that they didn't know what was wrong with them and why they couldn't focus. And that hit me very, 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 very hard. And I think that, like, with all the focus on keeping virus free, if you didn't have the virus, but yet you still found yourself unable to focus, or unable to get your assignments done, or unable to function in a way that you would normally function, somehow that was, the students expressed it as apologies for their inadequacies. And this upset me. I guess, which prompted the writing of the op-ed. Because as a medical anthropologist, I've studied conceptions of health and how communities stay healthy, and, throughout Southern Belize and now New York City and in Los Angeles. And thinking about health, as we often define it, is this physical health. And this is what we've been thinking about primarily, or what we were back in April when I wrote the op-ed. I felt like most of the conversations were about being virus-free and avoiding keeping your physical health, which is undoubtedly important. But as I was moving through the semester and prepping for a summer class that I taught, Intro to Urban Community Health, at Gutman, I was thinking that my work shows that health in many communities goes far beyond physical health, and yet, the World Health Organization has recognized this for years, right? They ratified in their constitution in 1940 that health is more than just the absence of disease. It's this complete and total well-being that includes, mental health and social health. My work ties health into traditional practice and environmental practice. And so when thinking through my work and the experience that I was having with students, I wondered if we were really thinking holistically enough about wellness as it related to our students and ourselves. And a kind of a little follow-up on the op-ed, when I did teach the Introduction to Urban Community Health classes that just recently finished, the summer classes, the students did a survey, like a free listing exercise in their communities, and I found that the frequencies from which their family members, themselves, their friends mentioned mental health as something that was the most important thing, the thing that was most on their minds when it came to health, was an incredible like preliminary finding as part of the course. And during the course, students were kind of given the permission to understand that the reason that they perhaps were struggling with their studies and struggling with their focus wasn't because they were inadequate, but because that we were really kind of myopic in the way that we were thinking about what health is. And this doesn't mean that we should ignore the virus or ignore physical health, but there's an expansive way of thinking about health that I think that we can get on board with. Everybody can be maybe nodding along with this, but it's not something that when we think about practice and we think about making decisions, structural decisions at the university, at the college level, that we necessarily think about this expansive definition of health and how we can best support students. And certainly thinking about economics, thinking about social relationships, thinking about mental health and mental health services, and how all that gets tied in, and family dynamics and relationships, and what it means to be outside of a space with our students, and for them to be inside these other types of spaces, and conveying to students that these pressures and these this sort of lack of focus, or this feeling like unsupported in some way, it's not because you're inadequate. It's because there's a real defining of health and wellness that extends beyond this absence of disease in the body, which of course is important. So as we're thinking about moving forward into the fall semester, I just wanted to end by reading the last paragraph of the op-ed, because I think it really sums up my hope. And it's not a hope that has been sort of reinforced. I wrote this back in April, and I'm still as worried as I was, or maybe even more worried, given the current state of the university and the public funding, and the crisis that is ongoing, but is been pulled into very sharp focus, particularly for our most vulnerable members of the union, and particularly for our students. So the last paragraph goes, "I'm worried for my students. I'm worried that the consequences of how we commonly define health as not being measurably ill will be so much greater than we can imagine when we're back to business as usual after we've conquered the virus and mourned those that it took. I hope a new normal emerges yet again. Is it possible in this moment to transform society so more of my students understand their ability to set aside the stress or grief or illness or economic insecurity to be productive is not at all related to their adequacies? I hope we take this very real opportunity to put aspirational definitions of health into practice and demand that structural inequalities with real health consequences be dealt with by leveraging the same urgency as our response to COVID-19. So what we're asking for is this urgency. I would ask you all, my colleagues, my comrades, to leverage this moment with an urgency to protect our students and our most valuable members, and to build a new normal that where austerity is not normal, where we just have to think about ways to cut budgets instead of fully funding um, work that is keeping our students healthy, keeping us healthy, right? These are real physical consequences. This isn't some intangible definition of health that is not as real as the physical definition. Like these are very real health consequences. So keep up the fight. I'm with you. Let's keep this conversation going, and let's bring the urgency that is so clearly needed in this moment to build a new normal that really addresses the health and safety of all of us.